the Implant Club surgical kit. This is a small little kit, but don't let the compact size fool you. Let's open it up and see what's inside. So this kit is curated by, well, Implant Ninja, and it's wasteful to do with more what can be done with less, right? So if you can keep it simple and keep these parts stocked and sharp, then you're far more likely to succeed than if you're trying to use 100 different drills and you don't know which one to use where and you misplace them. That's not the situation that you want to be in. What you want to have is a minimal kit and make sure that you always have the essentials when you need them. So let me show you what this kit has. So let's first look at these twist drills. These are your standard set of twist drills. They're coated black just to make it easier for you to see the markings, but they are a pretty standard high quality set of drills. There's nothing crazy about these, they just work. Now let's move over here. So you see up here, there's a position right next to the drills. These are additional pilot drills. So you do have this standard pilot drill right here, the Lance pilot drill, but over here, these are ones that I typically use as well. So let's take a look at them. These are super handy. I feel like every surgical kit should come with these, but unfortunately that's not the case. This is the Lindemann drill right here. So it's a serrated drill. So you can actually use this as a side cutting burr inside your preparation and change the angle of your prep. Now this one right here, I really like having this. So having a round burr, you can use this as a pilot drill for molars, or if you're doing immediate placement for molars, this comes in handy so much. And if you're trying to remove bone, so say your implant's buried in bone, or you have to do some alveoplasty, this just has so many applications with implant dentistry that having a round burr, a large round burr in your kit is a must. So this guy is definitely worth having in there. All right, so now going down here, you have your standard drill extender. That's the extender right there. Every drill kit has to come with an extender. There's no way around it. You need to use this for your anterior implant sites when you're hitting the adjacent teeth with your drill on accident. Your handpiece might be touching the adjacent teeth, so you need an extender. All right, so now moving to this middle section right here, these are your square bits. These two bits are for inserting the implant. So there's a long one and a short one. So this is the long one right here. This has a little square head on it, and this just pops right into this. And so now you can use this to insert your implant if you need to. You can use this if you want to maneuver your implant for any reason, but this thing also inserts into the hand driver. This also inserts into this guy too. So this is to insert your implant. And like I said, there's a shorter version too. When you have more limited space, you can use this short one. So you can actually take this part and stick it into the implant transfer and insert the implant that way. But remember, this is already going to have been sunk into the bone with that little plastic hand grip. And now this is very long, right? This is really long. You're never going to be able to get that into the posterior region. So you can use this shorter one, but this one's still pretty long, right? So this is still kind of like a bigger opening. And so what you want to do for posterior teeth, you can just take the little hand wrench that you have and use that, right? You can use that to sink the implant deeper. So that's really minimal, not very much space that you need right there. So you can use that to finish inserting your implant. These two guys are the prosthetic drivers. So just like we had a long and short up here, we have a long and short for prosthetic drivers. So this is the prosthetic driver, and again, this just inserts into that, and then you have your driver. And finally, over here, you have your parallel pins. The standard parallel pins that you put into your osteotomy just to help you gauge your angle during your implant surgery. This surgical wrench basically has no torque calibration on it, so it'll go as tight as you need it to go. So as long as you're seeing the arrow, it's going in. So you put that on your implant, and then that's making the implant go in. And if you want to take the implant out for any reason or back it up, you just turn it upside down and back it up like that. I sometimes do that when the bone is just a little bit denser than I want. I'll go ahead and do 2 turns in, and then I'll do 1 turn out, and then 2 turns in, and slowly that essentially taps threads and just gradually expands the bone so that your implant can go all the way to depth. Like I said, this kit is super simple, but it's got just the essentials. I like that because it doesn't have a bunch of stuff. It just has exactly what I need. Easy to keep track of everything, and with implant parts, keeping track of everything is super important, and making sure that you have the essentials is super important. So that's our box.